We have our next speaker today is Alexandra Berkovits, and I call her Alex. And I had the pleasure of meeting her actually recently in Florida at a event that's called the Fly-In. And it's where the nonprofit organizations in the United States get together. And we talk about how can we work closer together to serve the patient, serve that patient, serve the caregiver in that brain tumor, brain cancer, GBM space. And so Alex is going to talk to us a little bit about the different ways to prepare for appointments, understanding transitions in care, advanced care planning, planning for breaks, respite care, asking for help, crisis management, etc. When caregivers prepare for what they can actually control, it takes some pressure off and alleviates fear and anxiety. And I'm very excited for Alex's presentation because I remember as a caregiver, who knew I had any control, right? I didn't feel like I had any control. And I think that Alex's tools and her presentation will provide many of you with that, a way to control your space. So Alex, thanks so much for being with us today. Alex is with the Brain Tumor Network. They are a group. They're a national organization. They're based in Florida. And they also, it's patient navigation as well as patient education, and also access to social work services, which is so critically important. So Alex, I'm so sorry. Alex, are you ready?
I am ready. So I apologize in advance because this is a lot of information, kind of jam-packed. I got 10 to 15 minutes to talk, so there's a lot of stuff to go over, but I'm really honored to be here with you all today. And Laura, thank you for sharing your story and your strength. I do have a little bit of overlap in some of what I'm going to talk about, so I'll breeze through that, but I think it's good because it shows that it's real and that, we all experience some things that are similar. My hope is to share information with you guys to make the caregiver role a little bit easier to manage. And I'll start by sharing my connection to caregiving. My mother became ill when I was a teenager, and I became her primary caregiver as a newlywed in my early 20s. After she died in 2015 at the age of 52, I became a caregiver to my little brother with chronic illness before he died in 2016 at age 24. And although none of us embark on the exact same caregiver journey, the emotions that we feel, regardless of the circumstances, they feel the same. That fear, the anxiety, the sadness, the guilt, the grief, the isolation, the fatigue, the overwhelm, anger, like we talked about, and the loss of control. Since so much is out of our control, I do want to give you some tools to help you prepare to care in my presentation, and make the emotions hopefully easier to cope with. And for those of you in here who are caregivers right now, I really want to commend you for your dedication to your patient. Caregiving is an often thankless role, and you might feel like the invisible patient. But as you see here today, you're not alone. And thank you for doing what you're doing because it might be some of the hardest and most meaningful work you've ever done. Okay. So I want to help you guys fill your caregiver toolbox. That's what I like to call it. So we're going to discuss some strategies and resources for the beginning stages of a brain tumor diagnosis, the transitions that occur throughout the journey, crisis management, and self-care. Okay, nice. So a lot of information here, so bear with me. Some of you have already surpassed the initial stages after diagnosis, but it's never too late to learn what resources there are that maybe can simplify and improve your experience. Into the unknown. That's what I titled box number 1, because that's how I felt when my mom was diagnosed with a terminal illness and a life expectancy of 3 years. I felt like I was living in an alternate reality. Often with brain tumors, something happens. There's an accident, a fall, a seizure, a crippling headache, and boom, suddenly you're expected to become this brain tumor expert. I think Laura said, the world just flips upside down. Maybe your loved one was the primary breadwinner and now they can't work. And maybe they're at risk of losing their health insurance when they need it the most. Perhaps you're thinking, how am I going to pay my bills? Or what am I going to tell the kids? After the initial shock of the diagnosis, we educate ourselves about the tumor, the treatment options, the centers of excellence, second opinions, clinical trials. It can literally make your head spin. While learning, it's important to know your sources. Where are you getting your information from, and is it accurate? You can trust the information you receive from your doctor and the resources they suggest, but a lot of us still can't help it. We go down that Google rabbit hole. And then, out of the thousands of websites that populate, how do we sift through that? As a rule of thumb, health websites sponsored by the federal government are usually accurate sources of information. The last part of the website, like .gov, .edu, .org, they can help identify the type of organization that owns that website. Other websites can be misleading as they may present biased information. You might also take part in various Facebook groups where people share what works for them, but it may or may not work for you and your patient. The whole point here with resources and what you find is just always bring the information to your doctor to discuss it. Okay, getting organized. Easier said than done, right? After your diagnosis, your patient might have a biopsy, a surgery, endless appointments, chemo, radiation, scans. It's a lot to keep track of. Think about how you normally organize information. Are you a visual person who benefits from filing paper records, making lists, using Post-it notes? Or are you good with technology and you have everything scanned and saved on a computer? Maybe a little bit of both if you're lucky, but find what works for you. That's most important. I want to point out a couple of resources here on the slide. The American Cancer Society has fantastic worksheets to help you keep track of your patient's symptoms, their medications, appointments, and contact information for the medical team. There's also the Abridge for Patients app. So this is something that I learned about very recently. It can be downloaded on your phone, and you can use the app to actually record your appointments, of course, with your doctor's permission. You got to do that. And then the app actually transcribes what's recorded. So you can look back at the notes or even share the notes with family or friends who maybe you wanted at the appointment, but they could not come. So I think that's a great resource. I've played around with it myself and it works. Finally, identifying your strengths. I always say that whatever coping skills you used before, it's time to put them to the test. Think about the hardest time in your life before this. What helped you get through it? And can any of those skills help you now? Think about who's in your support network. Who are they? Where are they? Think about what's on your plate and try to prioritize those tasks. Can anyone else take over some of them? I know asking for help is difficult. You know, everybody says, let me know what I can do, or I'm here if you need anything. And while these are very kind statements, they make things harder on us because telling them what to do is a new task. So instead, I would advise having a list of tasks ready to send so you can respond with, here's what's on my plate. If there's anything if you might be able to help me with, I'd appreciate it. And then you send them the list. So whether that's cooking, cleaning, shopping, childcare, driving, whatever you need. When you respond with that information, know that some people might say no. Some people might not respond, and this can be hurtful. But it also, the silver lining is it shows you who's mentally and physically available to help with those tangible needs. We've talked about that loss of control and how preparing can feel like you're taking some of it back. You can't control the diagnosis or the disease trajectory, but you can learn about what to anticipate. You can plan for the what ifs. And this Transitions in Care booklet from UCSF is one of my favorite resources. It is jam-packed with helpful information. It introduces palliative care, which is often stigmatized as having to do with death and dying, when in reality, it's specialized medical care for anyone with a life-threatening illness. It's an additional team of professionals who are solely focused on symptom management, pain management, stress management, and quality of life. And it's not just focused on patients, but for caregivers too. The document reviews many helpful topics, including some painful ones. So apologize in advance, but what to expect in the final hours, what to do after someone dies, gut-wrenching things to think about, but so many people find comfort in knowing. All right, advanced directives. There's a lot of information here. Something we all should have, regardless of our health status. When I worked at Mayo Clinic, we asked everyone over age 18 if they had advanced directives. So if you came in for a hangnail, we asked you about advanced directives. None of us know how much time we have. And the biggest gift we could ever give our loved ones is information about our wishes, if God forbid we can't express them ourselves. You can see at the bottom of the slide, the Conversation Project. You can find this at theconversationproject.org. It's a very helpful resource that guides conversations about advanced care planning step by step. And I read a powerful quote from them, which says, "It always seems too soon until it's too late." I spoke with a caregiver actually this week, and while on the phone with me, she asked her husband about his end-of-life wishes. He surprised her, to say the least, by saying that if he were dying, he would not want to be on a breathing machine, and he would like to donate his brain to science. She's now trying to decide, would she be able to make those decisions on his behalf, because she doesn't necessarily agree with them. They might have one of their adult children be the decision maker so that his wishes are honored and carried out. I'm sure we can all agree that we'd like to avoid a crisis if at all possible. Both a physical crisis, like a medical crisis, and a mental health crisis can be life-threatening. When thinking about a physical crisis, it's important to talk with the medical team about the signs and symptoms that you want to look out for. Which symptoms require a trip to the emergency room or a call to 911? It's helpful to write down your crisis instructions because when we're overwhelmed, when there's a crisis, we're panicked, we're stressed, it can be really difficult to think clearly and rationally. But if it's written out in a way that is easy to read and find, like maybe it's on the refrigerator, you can quickly decide what to do and who to call. It's also beneficial to think about safety measures in the home to possibly avoid accidents, whether that's cushion flooring, covering sharp edges on furniture, grab bars in the shower, or medical alert systems. You might be able to anticipate the what ifs to avoid a crisis. Mental health is complicated. We already know that the rates of major depressive disorder in cancer patients are already much higher than the general population. And it can be difficult to tell if someone's depressed as a normal response to their diagnosis or if it's more. And to make it even more complex, we know that brain tumors can cause personality and behavioral changes. Whether it's situational depression or severe depression, it should be addressed. A suicidal thought or statement expressed is urgent. I want to make sure everyone knows about the 988 Suicide and Crisis Lifeline. For mental health support, you can call or text 988 You can go online at the website 988lifeline.org and live chat and get that support that you or your patient might need. Anyone who is struggling can use this service. Mental health professionals, support groups, and peer mentor programs can also improve mental health by instilling hope and helping people feel less isolated. Okay, guys, this quote is tough, but it's an important perspective. It says, as hard as it is, take care of yourself so you can take care of your patient. Try not to let this disease rob you of the present, knowing it may very well rob you of a future with this person. Laura talked about self-care, and a lot of this is repetitive, but it's being intentional about living well physically and mentally. We know that a lack of self-care can lead to caregiver burnout, which I'm sure some of you have experienced, mental health issues, and other illnesses, yet we still don't make it a priority because we don't really know how. When you think about self-care, it's an overwhelming idea. So like Laura said, let's simplify it, make it more attainable and sustainable. There are 4 domains of self-care. There's physical, emotional, psychological, and spiritual. I like how Laura talked about the self-care myth, but like she said, it doesn't have to be elaborate. We don't have time for elaborate as caregivers. It needs to be minimal, and the small things really do add up. Emotional self-care doesn't have to be a counseling session unless that's helpful and accessible for you, but it can simply be expressing your feelings, whether that's out loud or writing it down, connecting with other people, and practicing gratitude. Physical self-care is the basics. If we can't sleep, we can at least rest. We can try and find time to at least rest our bodies and our minds. Eating well, nutritionally, drinking water like we discussed, moving your body, stretching. It's keeping your own medical appointments so you have the health and stamina to continue to care for your patient. Psychological self-care can be reflecting, journaling, meditating, learning something new, the breathing. And spiritual self-care might be prayer, attending a service, reading, or listening to music. So I want to share a little bit more about where I work because it might be a helpful resource for you guys. We are a nonprofit organization with the mission to provide free, individualized navigation to patients and families dealing with a primary brain tumor diagnosis. We have Neuro-Oncology nurse and social work navigators on staff who are honored to help support you guys, no matter where you are in the brain tumor journey. You can see some of the high-touch navigation support services that we provide here on the slide, and I know Delanne touched on some of them. We know how much is on your plate, so we make it as easy as possible to connect with a navigator. You can visit our website online at braintumornetwork.org, or you can give us a call at 844-286-6100. So I can talk about resources literally all day long, but in the spirit of time, I just want to make sure that these links are available to you. Fortunately or unfortunately, other people have been in your shoes, and because of that, these resources exist. I tell my caregivers, you shouldn't run a marathon without your running shoes. I mean, you can, right? You can go outside and run with your flip-flops or your high heels, but it will definitely be harder, and you might end up with a broken foot. So prep for your marathon. Prepare for different scenarios so you can take back some of the control that a brain tumor diagnosis takes away. My contact information is listed here. If you would like a copy of the slides that have the resources and the links, please don't hesitate to reach out to me. Or if you want more information about the Brain Tumor Network, that would be great. Thanks so much.
Thank you, Alex. Such great information. Really, really cool. I have a couple of questions that have actually come in that I'd like to ask you. One of our attendees has asked something that I think is really important to talk about, and they're wondering, as a caregiver, how do you handle a situation such as this? How do you address issues like my husband wanting to install ramps everywhere when I know he probably won't be around to benefit from them? So really the question is, as a caregiver who is caregiving for a person with a terminal disease, how do you navigate those things that are going to happen, that the patient is going to want to do or ask for when you think that they won't be around to benefit from whatever it is? How do you navigate? What's that conversation look like?
Well, I think, first of all, that's a really difficult situation on the caregiver. So much to think about. I would say in that specific scenario that safety is top priority. And so if you're not wanting to install ramps and it's due to a financial reason, I just want to put it out there that there are financial resources out there that can assist with the cost. If cost isn't an issue, it might be beneficial to compromise and start with one ramp and prioritize where it needs to go. Where's the most important place that we need a ramp, and see how that goes, and then let some time pass and see how your patient, your husband, is doing. And then you can both decide together when and where to place the next one, if necessary.
Great advice. Another question that came in is, this is the caregiver speaking: how do I develop patience with my loved one and keep it?
All right. I'm sorry. Patience. Was that
Hey,
the question?
yes. How do I, so as a caregiver of your loved one, and I'm thinking this person, the patient has GBM. They wrote, how do I develop patience with what's happening with my loved one? And how do I keep that kind of patience? How do I keep that alive? What are the tools or the sources or the exercises that all of us can do as caregivers to really have more patience? Because we know as a caregiver, you get frustrated with your loved one, but it's not their fault. We know that, but it's still, we're human.
Yeah. So developing patience takes very intentional work. So it's not something, here's a tool and boom, you've got your patience. You can develop and increase your patience by practicing mindfulness, deep breathing, reframing the situation. I know I talked earlier about practicing gratitude and even setting boundaries. So if you're able to identify what your triggers are, once I hit this point in the day, I no longer have patience. Once you know what's going on, or maybe it's your patient, once they become angry, it triggers you. Whatever those triggers are, write them down. And then you can work on setting some boundaries around that. So for me, even as just a mom, some days I go home and I tell my husband that I have 20% patience left in me. And it helps him to help me. He tells me what he's got left in him, and then we figure it out. And at least he understands that if I snap or I'm, acting a little different, it's because my patience was already at 20%. And so I think that's important. I've told one of my caregivers recently, Brene Brown came up with that kind of idea with parenting, and I love it for caregiving. I really do. And letting your patient know, like, hey, husband, I know you're going through a tough time and you're not feeling well today, but my patience is at X%. And I just want you to know that's where it is, but I'm going to try really hard.
Yeah, exactly. I have one more question and then we will move on. Alex, this caregiver is joining us today and she would like to know, I'm going to read the whole thing first and then we'll circle back to the top.
Okay.
What are strategies for how to manage the thoughts of what is ahead? That anticipatory grief when things are stable is tough to manage. I have worked through it, but that emotional accordion coming in and out needs to be managed. I'm just curious what you would say.
Well, first of all, I've never heard someone say emotional accordion, and I love it because it's such an accurate description of what this can be like. So thank you to whoever wrote that. I would say it's normal to have those feelings. So normalize it and just give yourself permission to go through the feelings associated with anticipatory grief. Let the feelings come and then let them go. You know, those feelings don't stay 24/7. And if they do, reach out for help. I hear from so many caregivers that learning and preparing really helped manage some of that anticipatory grief. Also reminding yourself you can't prepare for everything, and the future can look different than you thought it would. But sometimes that planning that we talked about in the presentation can help with the anticipatory grief.
Okay. Are there any, are there any tools or strategies or something that sort of can walk people through, meeting that anticipatory grief ahead of time or while they're through it, while they're in it?
Yeah, there are some guidebooks online. Happy to share them with you. I don't have them right in front of me. I think there's one through Cancer Care, but I'd have to do a little digging and pull it up. But there is information out there, and anticipatory grief, it's different than the grief you experience after someone passes away, but it's also really similar in so many ways at the same time. So I think the information out there about anticipatory grief is good. I think the information about grief just in general is also really helpful.
Because even, grieving, anticipating your loved one's death is one thing, but literally anticipating grief between your MRI appointments is another thing as well. And that's that accordion, right?
Yeah, very difficult.
It's very difficult to manage. Yeah. Okay. Well, Alex, thank you so very much. Alex's contact information is right in front of you. She's a wealth of information. Thank you for sharing your personal story as well.
You're welcome.
Have had quite the experience as a caregiver yourself. Thank you. Yeah, thank you.